Transferring a patient with a portable floor lift. Raise bed height.
Can you roll over, please?
1, 2, 3.
Use the slider sheet to help the patient roll. Coordinate the roll verbally. Insert the sling. The base of the sling sits just above the tailbone. Feel free to drop the bed rail so you don't have to lean over it.
Okay. And roll over, please. 1, 2, 3.
Okay.
Slide the sling straps under the gap of the knee by pressing into the mattress. Remember to cross the sling straps. Choose and confirm the strap choice with your partner. If your patient is going to a chair, use the shortest strap that you can at the shoulders that you can put on without straining. Use long straps at the legs.
Are you ready to be lifted?
Yes.
If the lift does not go high enough, feel free to lower the bed to give yourself more room to work. Wheel the lift straight back. The lift turns the easiest when it's already in motion. Keep your back straight and use your large leg muscles to push and pull the lift. Bring the wheelchair to the lift. Always ensure you're moving the lightest piece of equipment the furthest.
Are you ready to be lowered?
Yes.
Coordinate with your partner as you lower the patient into the wheelchair. Pull the lift slightly forward, away from the patient as you lower the lift to protect the patient's head from being hit by the carry bar. Release the sling straps from the lift. Move the lift away to give yourself more room to work with the patient. Slide the sling straps out from underneath the patient.
Can you lean forward?
Follow the care plan as to whether you leave the sling in or remove it from the chair entirely. If you would like more info, refer to the link in the description below.